Hi, everybody. Welcome back to the NEIGH. I am Dawn Samuelson, founder and executive director of the National Equine Institute of Growth Through Healing. And I have my daughter Taylor back with us today. And we're here to talk about the fact that Miss Taylor is on the Chautauqua County Crisis Team. And I, as well, am a crisis worker for Chautauqua County. And we do the mobile unit. And I just wanted to talk about one of the reasons why I brought Taylor onto that or asked her to apply was because she's going into social work. And I felt that it was very important to get her out in the field and kind of see what's out there. So I'm going to pass it over to her and tell me what you think so far.
Well, I really enjoy it. I think it's been a very cool opportunity to get a lot of hands-on experience. And especially in the time of COVID, it's a very important time for social workers, for mental health professionals to be out there and meeting with people.
Yeah. Now, we won't talk about situations or names, but I wanted to kind of ask you, there were a few situations that you've gone on, and I know that they have certainly been something that you've probably never experienced. How did you feel about that overall? And tell me a little bit about how you were able to use maybe some of what you learned in school and maybe some of what you learned in the emotional coach with the NEIGH program.
Well, each experience obviously is extremely different from each other, and there's not an umbrella term or emotion to encompass all of these, but it's interesting to see a lot of what people are suffering with, whether it's physical, mental illness. There's a lot that people deal with on the day-to-day. And from a mental health standpoint, being hands-on and in that experience, a lot of numbers run through my head and symptoms and stuff like that. So when we're meeting with people, I obviously weigh my options and my diagnostic criteria and stuff in my head, but to an extent, I kind of throw that all out the window. It's more about the dynamic and interacting with the person and being able to read the body language and know when they are zippering up their coat nice and tight because they're getting defensive, and understanding if, is that something that's protective or is that, trying to just push you away kind of a sense. So being able to see that kind of hands-on while also understanding the emotional health component is really interesting. So I like it. I think it's cool. But I don't know. It's kind of a crazy experience. So recently, we've gone on a few calls that have been unfortunate. We do the best that we can to assist these people in any means that we can. But unfortunately, it's not enough sometimes. So.
Yeah, sometimes the system is broken.
Yeah.
And you feel like your hands are tied. But I think that one thing I have seen with you is, like you said, the knowledge and experience that you've gained through school, it almost sits on the back burner, and actually you become very empathetic, and your personality comes out when you're dealing with those clients. And I think that that's what I feel a lot of people want. They want someone to be real. They want someone to be able to listen. And then having the expertise to know where to turn for additional assistance.
Exactly.
Or for, more resources, I think has been really important. Has there been any particular call that has stuck in your mind? And again, we won't talk about details, but any call that you feel that you wish that you would have had a little bit more of experience on, or a little bit more of resources on, or you wish there was more that you could have given or helped that person with?
I think a lot of them are like that.
Okay.
Unfortunately, we truly do the best that we can with the resources that are available, but there's hop, skips, and jumps along the way that people sometimes unfortunately fall through the cracks.
Yeah.
And again, especially in the time of COVID when the hospitals are at max capacity, if there is a mental health concern and we write a 945 pickup order to send them to the hospital to be evaluated, unfortunately they don't have the manpower, the resources, the bed space to truly bring them in, evaluate them, and get them the help that they need, and unfortunately just send them home.
So I know one of the things that I've felt many times when I've been on those calls is I can empathize with the frustration of the family members. I think that if that was my family member and they're being evaluated or taken into the hospital and released in 30 minutes, their hands are tied. There's a sense of helplessness
Yeah.
that I personally have felt, and I think you may have felt that as well, that it almost feels like there's more we should be doing and just don't know what to do. I know that there's been a lot of agencies that are trying to collaborate and work together. Different police agencies are reaching out more to do more mental health. And I think that is with the rise in mental health issues. I know that we've been going out on quite a few calls. One of the things that I think about often is that I really wish there was more. We think about some of these homes that we're going into have very challenging family dynamics, and some of them are not very challenging, but yet the mental health stigma alone is challenging. So I don't know. I just kind of wanted to see how you feel as you move into this career as a social worker and would be moving into, a job such as this. What can you see being needed? What do you see being able to add to that type of thing with a crisis intervention?
That's a difficult question. I think being fresh to the field and being new to it and just jumping in kind of head first, I'm never gonna not strive for better, and I'm going to look for the resources that already are available to assist anybody in whatever that need may be. But unfortunately, like everything else, there's a major need for funding, manpower. Some kinks need to be worked out in the system and such. I mean, you can't really do much about that. But those resources that are available, that maybe take a little bit more work to get to, or a non-conventional approach, or meeting with somebody that's in a different side of the field or a profession and such, to see how they might be able to handle the situation, not only develops myself, because I'm learning and growing and stuff every day, but will help this person later. And it may not be the traditional track that I would like it to be, from A to B and so on, but it's still getting them the help that they need. I'm doing everything in my power to try and provide that to them, and for myself, knowing that, one, I did the best that I can, and or that they're safe, they're healthy, they're okay for the next night, for a couple of weeks, for the rest of their life, wherever that step may be. Coming to terms and accepting that, whatever that may be. But I at this point right now, I will never stop striving for better.
That's great. That's great. And one thing you mentioned was that non-traditional therapy, and that kind of brings me back a little bit to what we do with NEIGH. That is considered a non-traditional therapy, and we use horses to help with post-traumatic stress disorder. Some people can sit and talk to a counselor one-on-one, and some people are not comfortable with that. So with equine therapy, what have you found to be beneficial, or why do you feel that the NEIGH and the equine therapy seems to be so beneficial for so many?
I think it's because it's just completely opposite from the stereotypical therapy session. You're not sitting in a stale environment and just talking to somebody one-on-one. It's one-on-one, and there's a horse involved. And then you're outside, or you're in the arena, and there's so much more open space, and just like almost every facet of it is completely different than what the standard cognitive behavioral therapy is, and that's what we all know. Like that's just what the standard is. And I think that's what people strive for. And not only does the whole program itself just completely change the game, people are like, well, heck yeah, I get to go pet a horse. That's pretty darn cool. So I think that's just a cool dynamic that it adds to it. So I think a really important point also with like the NEIGH program and equine assisted psychotherapy is that the horses can't go off and run and tell your secrets. So people know that. They know that. And they're able to just kind of transfer all of that energy, that feeling, and whether or not it's verbal, and they tell them like what's going on, or tell you and I, the horse knows, and they can read it and understand it, and and so on and so forth, with the development of communication and teamwork and stuff along the way. Really is a healing perspective that's not, how are you feeling today?
Right.
You know, and it's stale. It's
right.
been used.
Right.
Not
right.
saying it's not effective by any means, of course, but it's a totally new game changer. It's just something for people to look forward to, and are just kind of can't wrap their heads around necessarily what it is or how it helps.
Well, and it's interesting because one thing that we do in equine therapy is we actually read the horse's body language.
We do, as the facilitators.
Yes, we do. And so we become a translator to a sense, where, that horse is very black and white, and he's going to tell you what he sees on your emotional code. Yeah. And we have a choice whether we accept that or not, but it's very factual. Mm-hmm. One thing that you had mentioned when we spoke last about, different social workers and kind of the burnout. One of the things that we offer with the NEIGH is the Beyond the Call program. Mm-hmm. And that is for our first responders, our police, fire, and EMS workers, as well as we have the Constance Project for the military. Mm-hmm. And what we found is that there's a lot of repetitive trauma that they're exposed to, as well as some of them have childhood trauma that they've not dealt with. So why do you feel that the equine therapy may be a great fit for this group of personnel?
Well, as you had mentioned previously, there is such a major, harsh stigma on mental health, and especially in those disciplines where they're taught to kind of buck up and suck those feelings down, and because carry on, tomorrow's a new day, and you don't know what you're going to see. You don't have that time to accept, comprehend, adapt, and so on. So considering that like NEIGH and the therapy program is a completely new ball game, exactly like I said before, people just kind of don't know what to expect. Yeah, they hear the word therapy, and there's some stigma with that, of course, but again, it's just bringing somebody into a ring that's not a small room where it's just one-on-one, where it's you hear the humming of the air conditioner and stuff, and you're focusing on anything and everything but what you're going through, and talking to the therapist. It's you and a horse, and with our knowledge, we read the horse and so on, and we can engage and continue on further without them necessarily saying, I've gone through some stuff.
Right.
And it's been pretty scary,
Right. Well, and I like to think, too, that with the NEIGH program, we're able to tap into a lot of different learning styles.
Yeah.
We deal with the kinetic learner and the audible learner, and just to be able to use the senses and the sight and the smell and, like you said, the sound. There's a lot of different things that are being used when you're working in that dynamic, that if you are a very audible learner, obviously being able to see something and work through it, or the next person may be a very tactile learner. Mm-hmm. Every piece of those learning styles are being touched on when we're dealing with equine therapy.
Yeah, absolutely.
So I think that no matter the learning style, there's something for you. Mm-hmm. And I think that most people do not have the horse experience, and actually that's okay. Mm-hmm. I think that is the horse therapist is a very strong and powerful tool to help us heal. Mm-hmm. And we're certainly proud to have you on as a facilitator. And everybody, come on out and see the program. It's theneigh.org, and we hope to see you soon. Until next time.